high loop gain apnea with CO2 stabilization through dead space used with CPAP, which I call enhanced expiratory rebreathing space. But most importantly, I like to acknowledge, of course, funding, NHLBI, ASM Foundation, but my patients who, well, these days there is much more known about breathing control and sleep apnea and so on, but not when I first started out in the 90s when OSA was thought to be somewhat important, but a boring disease. Just have to open up the upper airway. But my patients were willing to take some risk as I tested out some of my ideas on them, more or less. And thankfully, there was benefit, and the rest is history. Sleep technicians cannot really practice good sleep medicine without good sleep technicians. I call them my Jedi technicians who learned how to do very complicated titrations for those who had failed primary treatment with the CPAP, bi-level, and so on, using everything from oxygen, CO2 manipulation, acetazolamide, sedatives. We have complex lab protocols, and we really cannot manage our patients without technicians knowing that. And of course, someone has to manage the patients once we get the data. My two nurse practitioners, Serena Shire and Kimberly Campbell, handle most of my patients. And without them, I really couldn't do what I like to do. Okay, MJ is Mick Jagger. He said, you can't always get what you want, correct? So the top left is what we want. This is Philips Care Orchestrator showing nice stable breathing, 6 minutes per line. Oh, how I wish that all patients would be this way. The reality often enough is what we see in the bottom left, where you have ongoing periodic breathing, unstable breathing. And you see this kind of pattern about 30% of the time if you choose to look at the waveforms in Care Orchestrator or use software like Oscar and evaluate data from the SD card from ResMed machines. And the device can miss a lot of instability. So this is an example on the right of short cycle respiratory events and unstable breathing, which is not picked up as abnormal by the PAP algorithm.